All right, let's dive right into this explainer. Today, we're going to unpack a truly massive, cinematic scale problem. We're looking at what actually happens when one of the largest, most vital systems on the planet starts struggling under its own immense weight. We're talking about NHS England. It's an organization that literally touches tens of millions of lives, coordinating this absolute ocean of moving parts every single day. But look, make no mistake, this isn't just a healthcare story. This is a masterclass in massive, complex systems management. It's all about logistics, flow, and the physical limits of infrastructure. And it's a super crucial lesson in operation strategy that absolutely applies to any massive organization out there.
So I want you to think about this. What actually happens when a system of this colossal magnitude begins to buckle? Because we aren't just talking about a single factory line going down here. We're talking about thousands of facilities, hundreds of thousands of specialized staff, millions of patient interactions. The stakes couldn't be higher. It's basically a massive logistical tightrope. So when the coordination holding all these moving parts together starts to fail, what does that actually look like on the ground? How does a failure in operations manifest in the real world?
Well, the first and probably most visible symptom of a system under pressure is long waiting lists. But, we have to remember, these aren't just numbers passively sitting on a spreadsheet. In this context, a backlog means thousands of people stuck in limbo. It's the sheer psychological weight of patients waiting for crucial care, with their lives put completely on pause. In any massive operation, a backlog is essentially that first flashing red warning light telling you that your input has radically exceeded your throughput.
And then that bottleneck spills right out into the physical world. You get delayed ambulances. Just picture the chaos for a second. Rows of flashing blue lights to stuck idling in hospital parking lots, totally unable to offload their patients. You've got millions of dollars of highly advanced emergency resources that are essentially paralyzed. They turn into really expensive stationary waiting rooms, which means they obviously can't answer the next emergency call. The system's mobility? Completely neutralized.
But what's going on behind those emergency room doors? Severe staff burnout. See, when an operational bottleneck forms, the human toll on the workforce is just immense. Your most valuable, irreplaceable assets are degrading under unrelenting pressure. Surgeries inevitably get postponed, the margin for error shrinks dramatically, and the very foundation of the institution begins to crack. The system is literally consuming its own people just to stay afloat.
So let's move into Section 1, the visible crisis, uncovering the invisible antagonist.
Now, when the public sees these cascading symptoms, the wait times, the idling ambulances, the exhausted staff, the immediate assumption is almost always that the system just needs a massive injection of cash. Just buy more beds, hire more people, right? But the actual hidden reality, the invisible antagonist of our story here, is system coordination failure. It is operational inefficiency. That's what happens when processes consume more time, money, or resources than necessary to deliver a service. And just to be clear, we aren't getting into healthcare politics today. We're grounding this explainer firmly in operation strategy. It's about how resources, people, technology, and demand are actually coordinated and what happens when the underlying machinery of that coordination breaks down.
Which brings us to Section 2, the core operational bottleneck, the system-wide domino effect.
When operations become inefficient in a system this massive, the consequences don't just add up, they multiply exponentially. Millions of patient interactions are quite literally getting physically stuck. It's exactly like a massive manufacturing supply chain grinding to a halt. Think about it. A delayed ambulance means a patient can't get into the emergency department. And why is the emergency department overcrowded? Well, because there are severe bed shortages in the main hospital wards, so new admissions have nowhere to go. Okay, so why are those wards full? Often, it's because patients who are ready to be discharged can't leave due to a completely separate backlog in community social care. And because of those occupied beds, scheduled elective surgeries have to get postponed. It's a classic bottleneck. One single blockage prevents the next step from moving forward, because temporary storage capacity is entirely full. The dominoes fall backward until the entire production chain just freezes. Except here, the products stuck on the assembly line are human beings in urgent need of medical care.
Moving on to Section 3, the human resource crisis, when the system relies on people.
So we have to shift our focus from those physical bottlenecks, like the beds and the wards, over to the human beings actually running the system. Because unlike automated machines in a factory, you can't just scale up a skilled healthcare professional overnight. You can't just order a dozen specialized ICU nurses from a supplier, right? Training takes years. And when a system places unrelenting operational friction on those people, it creates a really dangerous, self-fulfilling vortex. Overworked staff inevitably experience deep burnout and fatigue, and that burnout directly leads to increased resignations and sick leave. So what happens when absenteeism spikes? It creates even greater staffing shortages, which throws the remaining, already exhausted staff back into an even worse pressure cooker. From a purely operational perspective, this death spiral turns human resources into the ultimate critical bottleneck, fundamentally capping the entire system's maximum capacity.
Let's look at Section 4, the digital disconnect, when technology creates friction.
This brings us to a pretty fascinating plot twist in our story. You'd naturally assume that digital transformation would be the ultimate savior here, wouldn't you? But in many massive legacy organizations, the supposed tech fix actually creates infinitely more complexity. Just imagine trying to run a global airline where major airports cannot easily share passenger information with one another. Like, what if Heathrow simply couldn't talk to JFK? Let the gravity of that analogy sink in for a second. That is the exact coordination challenge massive healthcare systems face without seamless digital integration. When localized data systems are disconnected, delays increase everywhere.
When your IT is fundamentally fragmented, with different departments using entirely incompatible systems, patient records just aren't integrated. And the result? An agonizingly slow administrative burden. You've got highly trained clinical staff forced to spend hours managing different screens, re-entering data, and fighting with software instead of actually treating patients. This directly slows down critical clinical decisions. But contrast that painful reality with true integrated operations. When you achieve real-time information flow and seamless data sharing, you unlock incredibly efficient resource allocation. Departments can actually anticipate demand before it arrives. It proves a really vital lesson. Just throwing disjointed technology at a problem is never enough. The real challenge is operational integration.
All right, Section 5, Leadership and Strategic Operations, shifting from reactive to preventive.
When you're running an organization of this colossal scale, it's incredibly easy to get trapped in a constant state of short-term crisis management. Resources are frantically redirected toward immediate emergencies, basically putting out fires day after day, instead of focusing on sustainable operational redesign. But breaking out of that cycle requires a fundamental shift in leadership strategy. It requires tools of empowerment. Take capacity forecasting, for example. That's the ability to see the storm coming before it makes landfall, allowing you to prepare rather than just react. Then there's workforce planning, which ensures you aren't burning out your best people. Lean operations and predictive analytics strip away the unnecessary friction, while continuous improvement systems literally rewire the DNA of the organization to get smarter every single day. See, operational inefficiency is rarely one single catastrophic failure. It's the invisible buildup of 1,000 small inefficiencies interacting over time. Once complexity hits a certain tipping point, leadership absolutely must adopt these strategic tools to redesign the system from the ground up.
Which leads us to Section 6, Universal Lessons in Operations, a blueprint for any industry.
Because if we zoom out entirely from the healthcare sector for a minute, you'll see these exact same operational principles are a universal blueprint. Think about global logistics, how one delayed shipping container cascades through a massive supply chain. It proves that interconnected systems dramatically amplify small inefficiencies into major crises. Or think about massive technology companies, where a lack of true resilience and unintegrated tech stacks can cause a global server outage. The lesson there is that true resilience requires long-term structural investment, not just band-aid problem solving. Look at any corporate HR department. Employees are not infinite resources, and prioritizing workforce sustainability is absolutely essential to long-term performance. The ultimate takeaway here is that leadership has to think systemically, not just departmentally. Because in a complex, massive organization, every localized operational problem eventually becomes everyone's problem.
I want to wrap up this explainer with a final, high-stakes question to leave you thinking. Is leadership across these massive global systems truly willing to redesign processes from the ground up before crisis simply becomes the accepted norm? Because as we've seen today, mastering operational efficiency isn't just about saving money, cutting costs, or boosting a corporate bottom line. In complex systems like this, operational efficiency saves lives. Thanks for joining me, and I hope this gave you a powerful new lens to look at the massive interconnected systems running our world.